So building on previous messages, I wanted to tell you how we in Bedfordshire Fire and Rescue Services have been getting on and some of the activities we've been doing to try to support our communities here, and also to discuss one or two of the challenges that we face over the next few weeks. So we still continue to deliver food parcels when they are needed, and our staff that are working in support of East of England Ambulance Service have now completed almost 2,000 patient interventions in which a firefighter from Bedfordshire Fire and Rescue Service has been involved. We've delivered about 150 deliveries of personal protective equipment to care homes and to chemists within our area to try to support them in the preparations that they are making so that they can also serve you better. And we have helped with the transport of around 350 sets of theatre scrubs to Bedford Hospital so that they have the equipment that they need to continue to function in these very difficult times. Using social media, we're trying to reach out to do our normal home safety work as much as we can. We are making a few in-person visits on a very risk-assessed basis to those that are most at risk. A lot of the work now we're trying to do virtually to support you in the safety in your home. And the same principles are applying also to the protection of our built environment, where we would, as much as possible, do virtual inspections, and this is absolutely necessary for us to visit a premises with the appropriate PPE and social distancing measures in place, of course. Operationally, we've dealt with, over the past 12 weeks, around 160 building fires, 360 fires outdoors, and a reminder again there about those bonfires: do keep them under control, keep them small if you need to have them at all. The tips are now open and functioning, so perhaps that'll alleviate some of that problem. Over 70 road traffic collisions on our road network, and we're also working in support and continue to work in support of the multi-agency local resilience forum, both in the response and now starting the recovery phase as we confront COVID-19 together. Apart from that, of course, we have to do all the normal things that an organisation does, you know, training, risk critical training in particular, risk critical maintenance of vehicles and equipment and buildings, payroll, information technology, HR, and all of those other things that we do. And of course, we're doing that whilst all the time thinking about new ways of working that enable people to work more effectively from home or remotely, and spend less time in a space together, and where they do that, to make sure that they can do that with sufficient room to be properly socially distanced, so we continue to protect our workforce so that they can continue to protect you. We have some challenges. I said I would talk about some challenges. We are coming up to some more warm weather, and that always brings a risk from water safety. And as I said before, please do not jump into open water or enter open water unless you're doing that with an experienced group who know the safe places to do that. Despite the fact that the restrictions are being eased, and we do need to get, you know, our commerce and our economy working again, the virus has not gone away. And in fact, here in Bedfordshire, we account for around 40% of the regional cases, whilst we only have 11% of the regional population. And we all need to bear in mind that disproportion, so that we think very, very carefully about the measures which we're being advised to take. So, you know, try to remain vigilant, face coverings where appropriate, and keep that social distancing. And unless you really need to go out, you are safest staying at home. Help us to continue to help you by protecting our service as much as we can and protecting yourselves. But if you need us, we'll be there.